Good morning, everybody. Our numbers today, we're at a total of 14,204 cases, which is an increase of 63 cases from the previous day. If you look at the last 4 or 5 days, we have been in the 60s range in terms of cases. I think a low of 52 and a high of 75. And fingers crossed that this has become our new ceiling. As we talked about the previous week when we had 125 cases, we said hopefully that was our ceiling. And then we hope this continues to be the case and continue to trend even further downward, particularly as we have reopened and increased testing. Our R naught value has been in the range of zero point 0.7 to zero point 0.9. I will say the zero point 0.9 number is influenced by that day last week where we had 125 cases. Again, it's factored over 7 days, but we continue to be below 1. We have tested now 7.9% of our population as of yesterday, which is over 83,000 residents. We have conducted over 96,000 tests in Montgomery County. Our 7-day average for test positivity is now 6.6%. A couple things to highlight. There was some guidance provided or there was a press release provided by the governor this week related to nursing home testing and reopening criteria. The state is conducting the follow-up testing in nursing homes that still continue to have cases. They are providing the test kits directly to those nursing home facilities and are coordinating and handling the analysis of those samples. Residents and staff will be tested on a biweekly basis until obviously, there are no cases remaining in those facilities. The county will continue to provide support to the nursing homes in terms of infection control, as well as overall guidance in terms of access to PPE, staffing, et cetera. There were also parameters provided for relaxation of precautions that have been put into place. There's an extensive document that lays those out, including that facilities must not have any evidence of an outbreak. Outbreak, again, in nursing home settings is defined as at least one case. So in order for a nursing home to be able to move forward with that, one of the criteria is that they have to have no cases, they have to have adequate staffing, PPE, etc. They have to notify the local health department to attest their readiness and ability to meet those criteria before they can move forward in discussion in terms of those provisions that would potentially allow for visitors, as well as allowing, for example, relaxation of dining requirements and allowing residents to be able to come together in restricted situations. Our team, our nursing home and L&R team, are completing infection control surveys of the 34 nursing homes in the county. They are to be completed by July 31st. As of today, they have completed 10 of those infection control surveys on an average of 3 to 4 a week. Moving forward to testing, we have consistent with our conversation from last week, we have conducted extensive outreach to a lot of different communities across the county, not just in those top 10 zip codes that have the highest number of cases, although we have concentrated a lot of effort there in terms of identifying venues as well as organizations to partner with to provide further testing. And thank you to a number of the council members who have provided feedback and suggestions and recommendations on individuals to reach out to do so. We do have a pop-up testing site that it will be at in Tacoma Park at the Tacoma Park Recreation Center on Thursday. Our goal is to test over 400 individuals. We're also accompanied by our colleagues within HHS to also provide linkage to social support services. This is the model that we are hoping to move forward and again be able to conduct in numerous sites. We have a number of other conversations that are not completed but in the works in terms of exploring venues in the East County area, Friendship Heights area, downtown Silver Spring as well. We also have at least one agency who submitted a proposal for the county to support testing with a goal of providing over 7,000 tests a week at their particular site. Additionally, we will be piloting with one of the local hospitals this week to conduct testing for their employees. And this represents moving forward with our high throughput option that we have discussed before, but rolling it out from a registration perspective, and then obviously being able to scale up as we had previously discussed. We also brought on our first set of volunteers from Project Hope, who will be assisting us in our mobile testing arm. We began the orientation process with them yesterday, and they will be participating in our current site with the goal of being able to roll out and extend testing on site in a number of different venues, whether it's a D&D home, assisting with the assisted living and nursing home populations, or supporting pop-up testing as we roll that out in the county. We have continued the conversations around the placement of the mobile units that we are been able to utilize from CDC. We are finalizing discussions about where they will be placed, and stay tuned for that, as well as continue to finalize discussions around expanding the testing to first line responders and county employees as well. In terms of contact tracing updates, 100% of the individuals, the new cases who have popped up in the system, the COVID-link system, have received an initial contact within 24 hours. Now, over 80% of those individuals there's actually been a conversation right within that 24 hours, and the remainder have followed up in that process. We have begun the process of interviewing contact tracers through the contracting agency. I'm not sure if any have been hired, but the interviews have started, and orientation and the training will begin on Monday, as well as we have had at least 2 conversations with community organizations to discuss partnering with them to extend contract tracing within their organizations to expand scope and outreach. Lastly, I want to say, actually not lastly, but next to last, is we have had further conversations with our colleagues at the state in Prince George's County in partnering to get additional epidemiology support from the CDC. The conversation with CDC went really well, and we are working on finalizing that proposal again with our colleagues in Prince George's County. And the last thing I want to highlight is we did have a couple of instances where we were providing guidance for some reopening criteria, including for parks. That has been provided as of this morning. So those efforts will be able to be moved forward in terms of reopening those provisions to society. And that concludes my report. Happy to answer any questions as always.
Thank you very much.
Sure that was 5 minutes, but close.
It was over, Dr. Gales, but who's counting, right? We can give you a little leeway. But we won't on the other speakers right now. Councilmember Friedson, you're the next speaker, please. The 5-minute rule is in existence. Please.
Appreciate it. First of all, thank you, Dr. Gales, Dr. Stoddard, for joining us again, for all your hard work. Appreciate, Dr. Gales, your response on the playground issue related to parks. I am hopeful that they can receive the guidance they need from what you sent, and that we can open the playgrounds safely. Make sure that they're following what you believe is best practice to keep our residents safe. We're certainly hearing a lot about that. Want to reiterate the need for clear, consistent, easy to understand guidance. I wanted to ask about Phase 3 and Phase 2. There was a lot of guidance that was provided, including the square footage rules and some other things, including playgrounds. It ultimately changed, fairly significantly. I think some of those changes were positive developments to make things clearer and easier, but I think it would have been even better if they had happened earlier. And so I just wanted to check on Phase 3, whether there are any considerations for changes to the chart that's been publicly shared, anything that's under consideration, and what the plan and process would be on getting that out to the public and to us.
Well, I think as it stands now, we have to see where the numbers go in terms of what would drive those decisions. So, at this point, for example, using square footage is, the more scientific proven way in terms of being able to guide capacity, as opposed to just saying, here's a certain percentage. So I think that, what those specific requirements would be. I mean, we can throw out a number and say we, would hope to extend it to this, but that would be in large part dependent upon where we are in terms of our numbers and the impact of the virus. And certainly we continue to refine as we get more information. And again, study other jurisdictions in terms of best practices to be able to present that information. I, at this time, don't have any further knowledge or comments in terms of the phase 3 stuff, because right now we're focused on the phase 2 aspects and making sure that we get all of the guidance out for that to make sure that the parameters and provisions are in place, and that we can continue to do that safely. My expectation is that when we are at a point where we are closer to moving to phase 3, not to say that those conversations aren't happening now, but then that, that further guidance would be provided before we launch and say we're here.
The one thing I will add is, as part of our recovery framework, and we'll be talking to you all there about that today, economic revitalization, we have sectoral groups that are focused on, things from, life sciences all the way through small businesses. Those individual work groups are actually going to be helping us in developing some unique guidance, because we've gotten a lot of questions, and I was going to talk about this as part of my briefing. We've gotten certainly over 100 unique questions that have all had to develop some policy associated with them. And in the future, we're getting a little bit better about identifying what are more global issues that we can clarify the overall executive order on, but where there might be unique guidance, we're actually referring those to individual recovery work groups that allow them to do some of the preliminary work around massage centers, around ice rinks, around, Dr. Yales knows we've gotten, every iteration of a question you could, well, not every iteration, but certainly many, many iterations of questions. And so our goal is to utilize the experts, and those groups really represent both the business sector as well as the county side to work out some of the future phase 3 guidance. And so that has been modified tasking that we actually talked about on Monday, and so we'll be rolling that into those groups as well.
Appreciate it. I was going to raise the question about ice rinks and massage businesses. We're getting a lot of questions about those two in particular, and so it would be helpful as you develop that information to provide us with as much information as we can, because we're taking a lot of these questions, and I don't think that the answers up to this point, we have very good ones to offer, except that we'll check and try to get back as best as we can. Just wanted to follow up on a request I made last week on the side-by-side chart of, here's what's open in the state and what the rules are for the state. Here's what's open in ours. Any progress on that comparison for clarity for residents?
Yes, actually. So I believe we have a chart that was being cleaned up. Leslie Prey from HHS had actually developed it. I saw a draft on Friday, and I think it should be going up. If it's not already up now, and I'll check that it's not, it'll be up very, very soon. They had to translate it from but take it from the product to actually something that can be put on the website and looks presentable. So
great. I'd love for you to get it up as quickly as possible, but it would also be nice if there's a request that comes from the council that you send it over to council members so we're aware that it's been posted, that you've fulfilled it. We'd like to credit you for doing something that we've asked. So
thank you very
let
much.
us know in order to credit you. Appreciate the time.
Thank you. Councilmember Reamer.
Thank you so much. Appreciate the report. I'm glad we're getting traction on testing. Appreciate that very much. It's been arduous, no doubt, and I think at the same time we're moving ahead. So I wanted to just look forward and ask Dr. Gales, Dr. Stoddard team, what are the critical barriers that you see to fully take advantage of the Advogenics capacity that we have, of the GeneDx capacity that we have? What do we need to know that we could do to really get to full execution there? What do you think are the issues that we'll be working to resolve over the next week, 2 weeks, and so forth?
Sure. Well, I think for the folks at home, they're two separate issues. So the GeneDx laboratory, we have been working with and using that supply for our nasopharyngeal swab testing components with our alternative test sites. From my understanding, I think that they are working as a lab also to be able to read oral self-collection kits as well, which would be great, expanding capacity there. And so those issues, we have used those. There were some issues within the state in terms of their practice in terms of accepting insurance. So that did cause a little bit of a blip. However, we continue to utilize that supply to support expanding capacity in terms of how many tests we provide at the alternative test sites, as well as increasing access. As I mentioned last week, we added an additional day at the Wheaton site on Fridays. So we've utilized GeneDx capacity for that. Now, as it relates to Advogenics, the issues that we've encountered have been more from the perspective of logistical stuff, namely in terms of patient registration. Because as you know, we've had some long conversations about it. Is in a testing rollout, the test kit is a piece of it. So you've got to have the test kit. You've also got to have the lab equipment to read it. But there's multiple components in terms of how you register, and when you register in the system, how it's ordered. Does that collect information, insurance information, things like that. And then on the back end of that is once the information is resulted, how is that reported? So there's two components. It has to be reported to the state. So the lab has to, it's a process called Elr Electronic Lab Reporting. So the lab must be able to communicate directly with the state surveillance system so that, and I'm not speaking to this to existence, but let's say, Councilman Reamer, you get a test and it comes back. We're going to say it's negative. So even if it's negative or positive, the lab has to report that result directly to the state system. And that has been fixed and that's done. And it's working. And the other component is how that information is communicated directly back to you as the patient. Now, in a normal, it won't say normal setting, but in a traditional setting, if you are going to your doctor would order that in the system and it would go to the lab. It would come back to the ordering provider. The provider would take a look at it and then release it, so to speak, to you as the patient to be able to follow up. As you can imagine, when you're doing high throughput testing where you've got hundreds and maybe thousands of individuals getting tests, you don't have that natural one-on-one relationship to be able to do that. So it's making sure that those types of things are in place so that when you utilize the system, there's not glitches, for example, in terms of the test being lost or the results being lost. So I say all of that to say, I think we've nailed down and hammered out all those details and fixed those, particularly from the registration perspective, to now be able to move forward and offer those tests. And so, for example, we've been doing some pilot tests to test the system to make sure it works. And Thursday's event will be the first large-scale one where we're utilizing that system from soup to nuts, from the beginning to the end. So I think we're there in terms of being able to scale up with those features, been ironed out, worked on, and being able to launch and scale up quickly.
So are we going to be fully utilizing Advogenics and GeneDx like this week, next week?
Well, the thought is that with the self-collection kits that we will be able to do more high throughput, higher volume testing in short time. For example, with self-collection kits, we can do 400 people within a 4-hour period, whereas in doing nasopharyngeal swabs, it's a lot more confined. We probably at most could do 100 to 125 during that time period. Now, we plan to utilize both avenues. So for example, we can do mobile testing events with the self-collection kits. We can utilize the staff to do nasopharyngeal swabs. So for example, if there's an outbreak at a D&D home or something like that, we could use both mechanisms to extend the scope of testing.
Thank you very much. Councilmember Albornoz.
Is that my 5 minutes? Am I done?
Yeah, yes, it is your 5 minutes, and yes, you were done on this one. No, it happens quickly. Councilmember Albornoz, please.
Thank you, Mr. Council President. So a couple of points. One, we still haven't received a response to the letter we sent as an HHS committee over a month ago, and as a follow-up to the committee session we had. Would love to get those responses as soon as possible. Within our group homes or disability community, there continue to be a lot of challenges on a number of different levels, and to get clarity on exactly what the plan is to help address those unique needs. We want to be helpful in serving as a bridge and a conduit to help communicate, because there are, of course, over 300 group homes. And so that's something that I know that Dr. Gales, you've been focused on, you're concerned about, and really appreciate all the efforts. But the responses to those questions, I think, will help clarify some of the concerns, understandable and legitimate concerns that have been raised in that community. And then conversely, I shared with you an article I read, and thank you so much for texting me back so quickly, over the weekend in the Washington Post by Dr. Wu, that basically had laid out 8 recommendations to help minimize the impact on people of color. And I'll note that many of the elements that are in that very well written, very clearly stated article are in the works. But to the degree to which we can create something that describes, in the same way we have the dashboard that provides updates to our entire county on what's happening with regards to testing, I think if we had something like that, but that was unique to the zip code approach, it'd be helpful. People would be better understand where to go, and I think there would be more clarity. The fact that we're reaching out to community stakeholders based on recommendations of the council is helpful for sure, but there are likely other organizations that are out there that may not even be on the council's radar screen that want to help and are in a position to do so. So I would strongly encourage you, as you respond to those series of questions within the letter, that we put something like that forward as well, so that our key stakeholders and communities who have the trust of the community will better be able to articulate to their constituencies what's going on. Here's the plan. Here's where we fall within that plan. Here's who to contact for what. And then some very specific metrics on goals of what we hope to achieve, which I think, again, in terms of communication would be helpful. I know it's another layer of work, but I think that will take some off of your plate if you have that kind of interaction with residents. And so I would strongly encourage you to do that. I did have 2 specific questions. The pop-up site you mentioned, which I appreciate going up, and I think over 400 visits, is that exclusively for people who are asymptomatic, or is that testing also for people whom are exhibiting clear evidence that they have the virus? And if it is just for asymptomatic residents, then why is that, and how can we expand upon it?
Sure. So the first thing, to your first point related to the letter, Public Health Services did provide input to the director's office, Dr. Kral's office. I know they're working on a response, and you should be getting a response soon. I can attest that it's in the works. And in terms of the pop-up testing, it's open for everyone. And so any individuals, if you're symptomatic or asymptomatic, you are able to come in for a test.
We may want to clarify that. We had a couple of people who signed up to volunteer who were told that people could only come if they were asymptomatic. So we can follow up offline on where some of the confusion is there, but I think that's an important point. And then with regards to that article we shared, what was your reaction to it? What was your thought? Is there a plan to put something like what I described together to be able to more clearly articulate to the community at large, who may not have the opportunity to listen into these briefings and may not be part of meetings that we're all part of right now, to be able to more publicly disclose what the plan is within those particular zip codes?
Sure. I can say that, it's being worked on. I think that I think we've got to figure out more efficient ways to get communication out, because there's lots of long hours, and we've got to rethink our strategy a little bit in terms of how to be more efficient and maximize the impact. And I think part of that is recognizing that we are not always the best messengers in terms of getting that information out. And so to that end, casting the broad net. So, we're thankful for the input that you all have provided in terms of recommendations. It's not the sole source of recommendations in terms of agencies without the community. And one of the things that we're actually excited about in our conversations with CDC, we were discussing mainly around epidemiology and disease control support, but they also do have some mechanisms in place to do the work that you just talked about. And they gave references of the work that they're doing in the Richmond, Virginia area as an example. And we have included that in our proposal to be able to assist. And then, as you mentioned, stand up things such as those that were mentioned in the article.
Thank you.
Thank you.
Thank you. Councilmember Jawando.
Thank you, Mr. President, and thank you, Dr. Gales, as always, for your work here. I'll be judicious with my time. We saw a large statewide positive test jump from June 15th to June 16th. Is there any discussion about what that's attributed to? Are you aware of that?
Yeah, so that actually refers to the blip that I mentioned. We even saw in Montgomery County where we had, like, I think it was 100. It was our only day over 100 for a while. And I think what, as best as I can tell, it could be a data dump in terms of testing. For example, there are some times where there are lags in the reporting of data. So, for example, there could be tests that are batched and are dropped on that day that could explain it, particularly given when you got it in the context of 6 or 7 other days where the numbers have been low. There hasn't been anything, at least from an epi perspective, in our jurisdiction to point to say, here, event X is what this was tied to. And so I would lean more towards the former explanation.
Okay, I appreciate that. That's heartening to hear. I was hoping that was the case. And it's good to hear that we move forward in testing despite what we now know on record were the president's admonition to his staff to slow down on testing, which is absolutely ridiculous. So I'm glad that we're not in that boat. The other question, we're in the phase 2 now. More people are opening up. You're seeing the curbside dining. You're monitoring compliance with the rules. How is that going in your estimation? A couple days in, have you heard any general feedback or complaints or uptick in calls? I don't know if this is Dr. Stoddard or what, but whoever can respond to that.
I'll say we haven't had to shut anybody down. We haven't had to, from my understanding, we haven't had to cite anyone yet. We've had some instances where we've had to go back and provide additional guidance and reminders in terms of the provisions and the parameters as they've been laid out. But so far, for the most part, people have been doing what they're supposed to do. And that's really, it's encouraging because that's what's going to get us to be able to move forward. Continued decreases in numbers in the setting of increased testing as well as increased opening of society. That is an indicator that the load of virus is lowering and lessening in the community, which is a good thing. But we'll have to continue to be vigilant, and we'll keep you all posted if we find out anything else.
Appreciate it. And Dr. Stoddard, it looks like you took advantage of the haircut being open. So did you have something to say as well?
My hair is long? What is
Well, yeah.
So, we visited 1,500, our ambassador program, which is run in DHCA currently, has visited 1,515 unique businesses and made 296 return follow-up visits if they found something. As Dr. Gales alluded to, in no case have we found something so egregious that we had to shut someone down, but if they weren't spaced out correctly or something along that lines, we'd make a return visit. 296 of those. No issues that warranted a further escalation, which is great. And so people are generally following the rules, and we appreciate. I certainly have heard from several members of council providing some comments on places that they thought needed maybe a checkup and some education. We've focused on the education, providing the materials, providing with the PPE, things that they needed.
Right.
So things are going, I think, as well as we could have expected.
I appreciate that, and I'll defer I am interested on the zip code and follow better, but I think Councilmember Navarro, my teammate's probably going to ask about that, so I'm going to yield back my time.
Thank you very much. Councilmember Rice.
Well, thank you. I'm going to be quick since most questions have been asked. Mine is just concerning new information that's been out there about the actual protection of those who have contracted COVID and whether or not they are now susceptible to contracting COVID again. It seems that their immunity is less than what we expected in terms of it's actually time centered. So wanted to understand the timing of that versus where we are and what we're talking about with potential fall spread. This is tied directly to our school system. So I'm very concerned about what we're talking about with the fall spike. Also, the level of immunity potentially decreasing based on some of the initial studies. Dr. Gales, you can just talk very briefly about that and what we're looking at and what our hypothetical, I know this is all new. So what is our hypothetical best guess and what is our guidance to folks as we approach and start to plan for the fall?
Sure. I think the best answer I can give you is there's one study that has said that there is your antibody protection is good for 2 months after infection. There's been limited information, so I don't have much background information to comment beyond that. Suffice to say that, we'll continue to follow that because the expectation is that if you've had it, your immunity should cover you moving forward. And so stay tuned. I think in terms of moving forward with the parameters with being able to reopen schools, I think, again, a large part of that has to be determined about based upon the viral load in our community. So the further we can drive that down and the less virus that's in the community, and we can quickly respond to those cases when they're identified, we again decrease, potential contact points between folks and networks of transmission. And so I think the state is the school system is an unenviable position trying to plan for lots of hypotheticals and, what ifs. And I know that they have been doing a good job. We've been a part of some of those meetings, providing the guidance as they develop strategies to be able to move forward and safely reopen potentially as early as the fall.
And the reason why that's so concerning is because, again, from a planning perspective, that is going to require some monetary support to be able to ensure safety. We'll want to try and budgetarily be prepared, especially in the light of the savings plan that the county executive has sent over, what that may look like and what we'll need. We don't want to cut off our nose to spite our face. And so from that perspective, it's going to be very dicey in terms of us making sure that we're taking the appropriate steps to prepare for something that could have additional expenses that are a part of it. Let me just ask another question. There have been in other jurisdictions, not necessarily here, and so I'm just curious to hear your thoughts, especially with our service providers, those who are dealing with dealing hair services and grocery stores, where we continue to see in states that those are where the spikes are happening. So the folks who are open and on the front lines, some of the things that we feared, again, not here, but in other states, namely Georgia, Texas, others, to where we've seen folks who are, providing hair services, grocery store workers, who are continuing to contract COVID at higher rates. What are some of the recommendations that we're giving? What do you think some of the faults are in terms of those areas and states in which we're seeing that? Is there something that we're doing right that they're not doing that is helping to protect, or is there something else we need to do in addition to ensure their safety for their workers as well as for the customers?
I think there are a couple things that I would say it's more of what the other states are doing incorrectly. I think that there was an effort to move forward very quickly to reopening activities when there was still a higher sustained burden of virus in the community, thereby increasing your chance of coming into contact with folks. A lot of those jurisdictions do not have provisions in requiring for face coverings to be worn, which again, we know is an effective measure in terms of preventing transmission, particularly from individuals who are asymptomatic. And so I think those are two factors that have spurred those jurisdictions in terms of having more cases. I think, again, it emphasizes the measured approach, and we have caught lots of grief for this. If I could make public all of the emails that I receive, questioning our credentials or saying things not quite so nice in terms of why we move forward. It's important to be able to drive the burden of virus down in the community as much as possible, because when you reopen things, you're creating less opportunity to come into contact with it. And some of those other jurisdictions didn't wait for that to happen.
Thank you very much. Councilmember Navarro.
Thank you, Mr. President, and thank you, Dr. Gills and Dr. Stoddard. So just trying to connect the dots again in terms of the issue of testing, but everything else that we're doing with the high impacted zip codes, and of course, those areas where we have a lot of residents of color, with Councilor Albornoz reference in terms of that article was very interesting, because as he said, we are doing many of the things that were cited. But what I would love is for us to, to get, if you will, not something super extensive, but maybe just, updating memos that kind of perhaps address what we are doing and what we're adding to some of these particular categories as, as we're starting to reopen, of course, residents, constituents, they kind of want to know. Some people may not be aware of what we're doing. I, for example, just received a constituent request wondering, what is the status of testing in District 4? What are the barriers? How are you ramping up? And so it is, very, I think, important and useful for us to have some of that information as much as we can in real time. I know things change every week, but I think also what was interesting about this article was, that, in my opinion, it was very straightforward and not very complex in terms of some of the things that we all can do. And again, we are doing many of that, but it would be nice to understand under each category how we're populating, most of those efforts. So if you could just talk a little bit about sort of the District 4 or just in general, those zip codes, again, just to recap, the testing sites that we're doing. And you mentioned that possible partnership, which I think I know which one that is. And if we could make that a reality, that would be super, super helpful. So if you don't mind, just very quickly kind of going through what you both have done up until now to strengthen that capacity in those areas.
Sure. I think one of the things, and forgive me, Councilmember Albornoz, for failing to mention this in your question, is something as simple as a calendar that we can put up online and say, here's the test site. So that is something that's being worked on right now. I'm looking at Dr. Bridges, who's reminding me that there's so much. So we're working on things like that now. So there can be a calendar that you can click on and say, on June 23rd, here's where the test sites are. So yes, those types of things are in the works, and that would be applicable across the county, across the different districts. Now, as it relates to the specific districts, what we're working on is saying, okay, where can the county come and step in and do pop-up testing? But also on the flip side, who are the community agencies or organizations that could stand up testing as well? So to the earlier point, who are those trusted entities in the community that people would feel a lot more comfortable going to test or sharing information versus here's a county site to come do that. So that's what we've been working on is, identifying those folks, whether it's a church or a nonprofit or some other entity who we could supply with tests and, make sure they have the infrastructure in terms of the registration and all those things, but they would be executing it and presenting it to the community. So our goal is to identify at least 2 sites within those zip codes and 2 sites or 2 organizations to be able to roll out testing. Certainly we'd love to do more, but at a minimum, that's what we're saying. We're committing to do some of the testing on our part, but also empowering those organizations and entities within those spaces to do testing. As you mentioned, working with community organizations around contact tracing. And I'm pretty sure what the organization you're thinking about is the same one. It's the same one we discussed last week. And we did have that conversation and discussion with them, and we're moving forward with that. As well as to the piece about communication and outreach in terms of being able to answer questions. So figuring some diverse strategies as well. Again, utilizing those within the network, within those zip codes and areas and districts who are trusted, folks within the community who can articulate the message, the shared message to the community and be able to answer those questions.
Thank you. And to the extent that we can get, as I said, a not very lengthy, but maybe kind of weekly reports on what has been added. Obviously, all of us are so embedded in the community and have, different folks that we might know that you might already know or not. But we want to be able to get to the point where we are actually executing all of this, right? as quickly as possible and identifying those gaps as quickly as possible because of what has been mentioned. Yes, as we are reopening, specifically in those zip codes, we want to make sure that we are not inadvertently, because that's where the load may be the highest, go backwards. So I think this strategy is going to be central in doing that. And I just would like to know like where we are in terms of implementation. What stage are we in terms of that? Dr. Stoddard.
I know you're at your time, so I'm going to take 10 seconds to answer this.
Okay.
We're also doing the same thing with our ambassador program. We're prioritizing zip codes, and we do have the data that we could provide on businesses that we visited in the various zip codes, and that was a prioritization that was done very early on. We have the data for all of that as well.
Thank you.
Thank you. Council Vice President Hucker.
Thank you, Mr. President. Let me just start by thanking both of you. I always mention your hard work, but thanks for moving us in the right direction on this. It's really striking at a time when most of the country is moving in the wrong direction, and we've had so many states now seeing increases, and when they've presumably because they've impetuously moved forward too quickly. I know you resisted a lot of pressure, and I'm just grateful that when I look at the dashboard every day, I'm seeing every one of our indications, almost every one at 14, declining 14 out of 14 days. So thanks again for getting us to this stage. Just a couple quick questions. Specifics. One that I haven't had a chance to ask, but coming from constituents. One in particular, tattoo parlors. I know we're originally in phase 2, now they're in phase 3. Dr. Gales, what's your thinking about them? The owner of tattoo parlors I've talked to says no more risk in what I do than what barbershops do. What are your thoughts?
So based upon the CDC parameters, it does carry a higher risk, which is why they are, would likely be an activity included in phase 3. And, in terms of the duration, the proximity, and the quality of the interaction. And so based upon that, that's why it's separate from a barbershop appointment.
Okay, thanks. And then wellness centers, they were also compared to other things that have been allowed to open.
Again, similar rationale based upon the science, based upon risk of transmission. We've grouped them in what would likely be included in a phase 3 level of activities.
Thanks. And
those are both, and I'll also note, those are both areas that we are going to be looking at with our recovery work groups to develop specific guidance around those two that will likely. I mean, I'm not going to promise that they're going to open up in a matter of weeks per se. But certainly if we have good, strong guidance that we think is protective, we'll be able to move forward sooner than if we did.
Thanks. And then final question is, people talk about the day when there will be a vaccine available as just an end point when no one will have to worry about anything at all. Is that realistic? That's certainly not how the flu vaccine works. I know there's various strains of the flu vaccine, and it wouldn't be the case here. But once there is a vaccine, is it likely to work in all cases for every person?
Well, the expectation with any vaccine is that, first obviously you want everybody to get vaccinated. But, the concept of herd immunity is that if you get a critical mass of folks who are vaccinated against it, it will interrupt transmission from person to person and decrease networks of transmission. So that's our realistic goal. And certainly if we do get a successful vaccine candidate, we are going to push it out like crazy and strongly encourage everyone to adopt that strategy to help prevent transmission.
Okay. And I would also add what's likely to happen after we have a vaccine, or after a significant, we don't want to go through our entire pool of people and have them all be infected. But what happens in the trends of virology is that the virus becomes less severe over time because more people have had it once. And so the second, even, and I think Councilmember Rice was referring to this, even if you can get a second infection, it's far more likely that second infection is going to be less severe than it would be the first time you've been exposed to it. And so what happened with H1N1 is still with us. It's become part of our normal, seasonal flu. So, I mean, not to say that that's necessarily going to happen in a short time frame, but that's very likely the way COVID, it will just be with us and be one of those things that because we've been exposed to it once or have a vaccine for it, the complications are much less regular.
Okay, good to hear. Thank you, Mr. President.
Thank you. Councilmember Glass.
Thank you, Mr. President. I'll make this quick. During this conversation, there was some breaking news from down the street in Washington, D.C., where Dr. Anthony Fauci says that a COVID-19 vaccine could be ready by the end of this year or early 2021. And his quote is, "It's a when, not an if." And so as we keep looking down the road, recognizing that we will continue doing all the work that we can. And with that, I'll say again, thank you to all of you who are working tirelessly. I want to just go back to the point that the HHS chair, Mr. Albernaz, made about the GO teams and making sure we find out what happened here and really make sure that our communities of color have the testing, not only access to testing, but then also get the results. And so we really need to solve that. And then I'll loop back by saying, we are spending a lot of time here focusing on communities of color because they have been most impacted by this pandemic. That might be very well why one of the reasons why the president admitted earlier, this week that he tried to stop and slow the amount of testing that's taking place across the country. But that aside, I just want to again say thank you to Dr. Stoddard and Dr. Gales and all of our teams here in the county for working as hard as we can to get everybody tested, to get them the results, and to try to make our community safe for everybody. I know there have been fits and starts, and I know that it hasn't been easy, but as has just been noted, when we look around the country, we are taking this very seriously, and I seriously appreciate you all being at the helm of this important effort. So thank you.
Thank you, Dr. Gales. We are at 12 o'clock. Councilmember Reamer actually wanted to ask another question. Can you take that?
That's
and
fine.
if we hold Councilmember Reamer to 2 minutes, will that work for you?
That's fine.
Councilmember Reamer, will 2 minutes work for you?
I was actually going to say if there were other questions, feel free to email me, but I'm happy to address now. That still applies, but I'm happy to.
We're going to give him 2 minutes. I'm timing you, Hans. Go ahead, please.
Well, thank you. I will send written, thank you for the replies to Andrew Klein and your team for the tracing. We haven't yet received the first report. I understand the executive branch would prefer to do weekly. That can be fine. When do you expect we'll get our first report on tracing?
So I guess we have to discuss what parameters in the written report. I mean, my anticipation was that providing the report, the information and data in this setting as well as our Friday call would suffice, but we can sit down and hammer out what are the specifics that go within that so that we can have, set up a weekly template so that we can populate the information and get it to you all quickly.
That'd be great. Thank you so much. I don't feel that I heard specifically what you have identified as barriers that we need to resolve in order to expand testing capacity next week. I did hear you, describe what you're doing and what you hope to achieve. So, I'll just reiterate, if there are any regulatory or funding, anything that we can do so that we fully maximize our testing capacity, we're here to make that happen for you.
Much appreciated.
Thank you. And you actually came in under budget, Councilmember Reamer. That was pretty impressive.
You can save it for Friday. How about
that? Yeah, that was good. That's right. Watch this space. All right. Thank you. Dr. Stoddard, did you have anything in addition to add?
I'll just add a couple of quick notes, and I think they're just for the benefit. So we did establish a Q&A team. I referenced this a bit. They've answered over 80 questions so far. Jed Millard from Department of Finance is I know we worked with the council previously, is leading that team right now. And they're addressing questions. We basically have a standing meeting every day to try and knock through questions that we receive and provide answers to, and where it requires develop specific guidance for it. 311 continues to see a reduction in the COVID-related calls, particularly now that the EARP and the HHS rental relief programs have their application process have closed. Those two grants have reduced, but there's still about 40% of the calls, and 80% of those calls are in Spanish. We've seen an uptick, and about 15% of the calls coming into 311 overall are social services, and so we've definitely seen an uptick in the need for social services. This is reflected both at 301, but also in our food access call center, where we've seen an uptick every week in calls coming into that center as well. And so we can tell that the community need is continuing to expand, not contract, even though we're seeing contractions in the virus. And so we know that that's going to mean that we're responding to the economic impacts in a more vigorous way going forward, not necessarily seeing, a calming of things in that arena. We do, and the final thing I will note is we are in the process. We did bring in some additional support to work with us on the FEMA public assistance reimbursement process. We brought in some expert support from some consultants to maximize our opportunity. The nice thing is their efforts will be reimbursable themselves, and so they're going to help us be able to maximize the amount of resources that we can bring into Montgomery County. We are working also with Senator Cardin's office on some, this is a unique event in terms of FEMA public assistance. And so they've given us some answers that we didn't necessarily agree with. And so we're utilizing the Senator's office to help us, and as well as the state, to appeal some of their decisions to maximize the dollars that we're bringing into Montgomery County, because we know that anything that we bring in from FEMA will go above and beyond what we have from the CARES Act. And so we're working on that. We had a child care town hall yesterday. We have a faith-based community town hall this afternoon to provide additional guidance and feedback to those areas. We're looking for additional opportunities for town halls and Q&A opportunities moving forward, because they're well attended and well received. And so I will stop there.
Thank you very much.